You know, there's a moment almost every man over 60 feels embarrassed about but never talks about. It's that moment in the middle of the night when the whole house is asleep, yet you open your eyes, feel that tight pressure in your pelvis, and quietly step out of bed to use the bathroom. Once, twice, sometimes 3 times a night. I've seen so many patients like this. One of them was Harold Thompson, 67. A kind, hard-working man who spent his entire life taking care of his family. He told me, "Doctor, I'm fine during the day, but at night, it feels like my prostate becomes a completely different organ. The moment I lie down, it starts acting up." Harold had no idea he was doing one small thing before bed that made his prostate tighter, more sensitive, and easier to irritate. And that tiny mistake didn't just wake him up. It kept his whole body from recovering properly through the night. The truth is, most men over 60 are repeating the exact same mistake without realizing it. Our prostate is already a sensitive organ. It's affected by inflammation, hormones like DHT, and blood flow in the pelvic area. And at night, when the body is supposed to rest, prostate tissue becomes even more reactive than during the day. So just one wrong habit, or the absence of one simple nighttime routine, can make nighttime urination, pelvic pressure, or restless sleep so much worse. But here's the good news. Add just one right habit before bed, and your prostate can calm down, become less reactive, and stay more relaxed throughout the night. That means deeper sleep, fewer bathroom trips, and more comfort. So today, I, Dr. Emily Carter, am going to show you exactly what to do every evening to help your prostate cool down, reduce nighttime urgency, and support your male health naturally. It's a small habit, but it makes a very big difference. If you're waking up 2-3 times a night, if you sleep lightly, if you feel pressure in your pelvis when you lie down, then this video is made for you. Before we dive into the key nighttime habit every man over 60 should practice, let me introduce myself so you feel confident in the guidance you're getting. I'm Dr. Emily Carter, a board-certified urologist with 14 years of experience working with thousands of older men. Men just like Harold, and just like you men, who are trying to reclaim comfort, confidence, and prostate health. And the truth is, most of my career hasn't been spent in the operating room. It's been in quiet consultation rooms, listening to men over 60 share things they hesitate to tell anyone else, waking up multiple times a night, that irritating pelvic pressure, a weaker urinary stream, year after year, and the silent worries they've held inside for so long. My mission, and the entire reason I create these videos, is to help men over 60 understand something important. Your prostate doesn't always need strong medications or surgery to feel better. Often, it's the simple things you do each night that determine your sleep quality, your mood, and how your body feels the next day. So in this video, I'll share with you the same advice I give my patients. A small, natural, safe, nightly habit that makes a very real difference in prostate comfort and nighttime health. Before we continue, I want to ask you something very important, because I want every upcoming video to truly match what you need. How old are you? And what bothers you the most at night? Nighttime urination? Pelvic pressure? Difficulty sleeping because your prostate feels more sensitive at night? Please leave your age and the state or country you're watching from. I read every single comment, and every week I adjust my content based on the real challenges men over 60 are facing. Your comment doesn't just help me. It also helps other men realize they are not alone in this journey. When you fall asleep, your body switches into a mode called rest and repair, what we call the parasympathetic state in medicine. This is when blood pressure drops slightly, your heart rate slows, and your entire system begins repairing the damage accumulated throughout the day. But for men over 60, things don't always go smoothly. The prostate is a very small organ, yet it's extremely sensitive to blood flow, hormones, and inflammation. And what most men don't know is, nighttime is when these factors become the most imbalanced. When you lie down, more blood naturally pools in the lower abdomen and pelvic region. If circulation in that area isn't strong, a condition known as pelvic congestion, the prostate tissue becomes much easier to irritate. It reacts by creating that pressure, discomfort, or sudden urge to urinate that wakes you up. And that's not all. At night, hormones shift, cortisol drops, while melatonin rises. This change directly affects the smooth muscles around the urethra, the muscles responsible for controlling your urine stream. When these muscles tighten too much, combined with a slightly enlarged or mildly inflamed prostate, you begin to experience a weak stream, constant nighttime urgency, interrupted deep sleep, 2 or 3 bathroom trips, even if you were fine during the day. And there's one more factor most men overlook: low-grade chronic inflammation. It's extremely common after 60, especially in men who sit a lot, move less, or eat more processed foods. This chronic inflammation makes the prostate even more reactive at night. So if you find yourself waking up at the same time every night, feeling pelvic discomfort, or getting up to urinate without any clear reason, it's not just aging, it's your prostate reacting to the body's nighttime physiology. The good news is, with just a few small changes before bed, you can help your prostate relax, reduce inflammation, improve blood flow, and sleep much more deeply. The first habit I usually tell my patients to do before bed sounds incredibly simple, but its effects are far more powerful than you might expect. And it is this: drink a small cup of warm water, about 80 to 100 milliliters, 90 minutes before going to sleep. Why warm water? And why specifically 90 minutes? Because warm water helps activate the parasympathetic system, the part of the nervous system responsible for relaxation, lowering inflammation, and soothing the soft tissues around the prostate. As the warm water moves through your stomach, that gentle heat sends a de-stress signal throughout the body, helping the pelvic region relax naturally. And the 90-minute window is the key to making sure this habit doesn't cause nighttime urination. It gives your body enough time to absorb and use the warm water, but also enough time for your bladder to finish its job and settle down before you fall asleep. When I gave this habit to men who struggled with years of nighttime urination, they were surprised, because within just a few days, the pelvic pressure eased significantly. The nighttime urine stream felt less urgent and less forceful. Their sleep became deeper and more continuous. Most men think drinking water near bedtime will wake them up more. But when the timing is precise and the amount is right, the effect is the opposite. This small amount of warm water actually helps calm the prostate tissue, reduces the tension of the smooth muscles around the urethra, and lowers the urge to urinate in the middle of the night. It's simple, free, takes no effort, and works for any man over 60. But it sets the foundation for helping the prostate begin the night in its most relaxed, quiet state. Now, the second habit I want you to practice each night is a very simple technique, yet it has a remarkably powerful effect on calming the prostate and reducing pelvic pressure. In medicine, we call it pelvic relaxation, relaxing the pelvic floor. Your pelvic floor is the group of muscles between the anus and the genital area. These muscles are essential for controlling your urine stream, supporting the prostate, and maintaining healthy blood flow in the pelvic region. However, once you pass 60, these muscles can easily slip into a state of chronic tension, often without you even noticing. When the pelvic floor stays tight, it pulls on the urethra, creates more pressure around the prostate, and triggers sudden urges to urinate or a weaker stream. That's why many men wake up in the middle of the night, even though they feel completely fine during the day. Fortunately, just 5 minutes each night can help this entire area relax naturally. Here's how. Sit or lie down comfortably. Inhale slowly through your nose, letting the breath fall into your abdomen. As you exhale, imagine the pelvic floor dropping down, gently opening, softening, and relaxing. No squeezing, no tensing, just letting go. Many men have told me they never imagined something so simple could make such a big difference. But according to experience from urology centers like the Cleveland Clinic, this is one of the most effective techniques too. Reduce pressure on the urethra, calm prostate tissue, support smooth, uninterrupted sleep, lower nighttime urination within just a few days. When the pelvic floor relaxes, the prostate can breathe better. It's no longer compressed or pulled tight. And that's exactly what reduces the urge to urinate at night. If you sit for long hours, drive all day, or have a low-activity lifestyle, this habit becomes even more important. Only 5 minutes, yet it brings a sense of relief that many men spend years trying to find. The third habit I want to share with you is an incredibly gentle technique, completely painless, but remarkably effective at improving blood flow to the pelvic area. And that habit is a light massage of the lower abdomen and groin for 2 minutes before bed. The prostate sits deep inside the pelvis, and while we cannot physically touch or massage it from the outside, we can influence the major blood vessels that feed and drain this region. The lower abdomen and groin are home to many important vessels, branches of the iliac arteries, veins that return blood to the heart, and lymphatic pathways that help reduce inflammation. When you gently massage these areas, you help increase blood flow into the pelvic region, reduce blood pooling, which is common in older men, calm the prostate tissue by improving steady circulation, ease heaviness, tightness, or numbness around the groin and lower abdomen. Here's how simple it is. Place both hands on your lower abdomen, just below the navel. Make slow circular motions clockwise for 30-40 seconds. Then move your hands down to the groin area and massage with light, outward strokes. Repeat for 1-2 minutes. I've taught this exercise to many patients dealing with nighttime urination or pelvic discomfort, and the results are often impressive. After just a few nights, they reported, the pelvic heaviness disappeared. Nighttime urges felt less sudden. Their urine stream at night became steadier and stronger. Their sleep became deeper because the pelvic tension was gone. The important thing is this: never try to massage the prostate directly, and never use strong pressure. The prostate responds best to gentleness, not force. Just 2 minutes each night can significantly support pelvic circulation, the exact thing your prostate needs most after 60. Now, the fourth habit isn't about adding something, but about avoiding a few small things before bed, because eating or drinking the wrong thing in the evening can irritate the prostate immediately, and that irritation shows itself most clearly in the middle of the night. There are 3 things I always ask men over 60 to avoid within 3-4 hours of sleep, because they trigger urethral inflammation, smooth muscle spasms, or increased pelvic congestion, all of which make the prostate more reactive and worsen nighttime urination. Number 1. Spicy foods. Chili, pepper, hot sauce, they all contain capsaicin. Capsaicin causes sudden dilation of blood vessels, making the urethra and tissues around the prostate feel warm, irritated, and hypersensitive. If you ever ate spicy food at night and noticed you needed the bathroom more, that was not a coincidence. That was a direct physiological reaction. Number 2. Alcohol. Many men think a glass of wine or beer helps them sleep, but for the prostate, alcohol is a strong irritant. It overstimulates the bladder, makes the urethra more sensitive, and increases muscle spasms around the prostate. The result? Nighttime trips to the bathroom, restless sleep, and a sense of pelvic agitation. Number 3. Salty or processed foods. Cold cuts, canned foods, sausages, chips. Anything high in sodium makes the body retain water, which increases pressure inside the urinary system. During the day, you may not notice it, but at night, this water retention places extra stress on the prostate. Mild inflammation rises, pelvic tightness appears faster, and the urge to urinate becomes much stronger. When I asked my patients to simply eliminate these 3 triggers in the evening, many returned just days later saying they slept deeper, urinated less at night, and the pelvic discomfort they'd lived with for years had vanished. These improvements didn't come from medication. They came from removing the silent irritants the prostate has been battling for years. Just remember, the gentler your evenings are, the calmer your prostate will be. Finally, the 5th habit I want you to practice each night is one of the most powerful things you can do for your prostate, even though it has nothing to do with food or movement. It is a gentle breathing exercise lasting 4 to 6 minutes that shifts your entire nervous system into deep relaxation, what we call the parasympathetic mode. When your body enters this state, The very first things that happen are the smooth muscles around the urethra relax. Blood flow to the pelvic region becomes steadier. Low-grade inflammation inside the prostate begins to drop too, and that helps you sleep more deeply, without being awakened by sudden urges or pelvic pressure. Here's the simple exercise. Inhale for 4 seconds, hold for 2 seconds, then exhale slowly for 6 seconds. As you exhale, try to extend the breath as long as you comfortably can. If possible, imagine dropping all the pressure from your pelvis with each breath, letting the stress of the day leave your body. Multiple studies on men's urinary health, including research on lower urinary tract symptoms, LUTs, show that controlled slow breathing like this can reduce smooth muscle tension around the prostate, increase pelvic blood flow, improve sleep continuity, decrease nighttime urinary urgency, support natural recovery during sleep. In my clinic, this is the exercise I teach almost every man over 60. No equipment, no complicated technique, just your breath. Yet it can recalibrate an entire system that has been under stress for decades. When you combine this breathing practice with the 4 habits I shared earlier, your prostate enters the night in its calmest, least reactive, most comfortable state possible. Just a few minutes. But the key to deeper, uninterrupted, more refreshing sleep, something many men in their 60 seconds, 70 seconds, and 80 seconds have nearly forgotten. I want to tell you about George Miller, a 71-year-old man from North Carolina. George is one of the patients I'll never forget, not because his condition was severe, but because he represents so many men over 60, quietly enduring their discomfort. On his first visit, George told me something that stayed with me for a very long time. "Doctor, I'm not afraid of illness. What I'm afraid of is waking up 3-4 times every night, then feeling so exhausted in the morning that I don't even have the energy to take care of my wife or play with my grandkids." George had no idea that everything he was experiencing, nighttime urination, pelvic pressure, restless sleep, was connected to chronic tension in the prostate, something that had been building up for years. He told me that every time he lay down, the heaviness in his lower abdomen grew stronger. He slept lightly, woke up easily, and every time he got out of bed, he felt like someone was gently squeezing the inside of my pelvis. During his examination, I noticed 2 things. His pelvic circulation was poor. His pelvic floor muscles were chronically tight. Part of this came from driving trucks for 40 years, and part came from his habit of drinking a bit of alcohol at night to help him sleep. I told him something I want to tell you today. Sometimes, the prostate doesn't need medication. It just needs to be relaxed properly at night. George began practicing exactly 3 habits every evening. A small cup of warm water 90 minutes before bed, 5 minutes of pelvic floor relaxation, a 4-6-minute slow breathing exercise. Only 10 days later, he returned with a smile I rarely see from men who have struggled with sleep for years. He said, "You know, doctor, now I only wake up once or twice. Every morning I feel lighter. My mind feels as clear as it did when I was 50. That change wasn't magic. It happened because George finally learned how to reduce nighttime pressure on the prostate, giving his body a chance to recover instead of staying tense all night. I'm sharing his story, so you'll know this. If your body is still reacting, still uncomfortable at night, there is a way to help your prostate calm down, and sometimes the right habits are all it takes for things to start changing. When it comes to prostate health after 60, most men think immediately of medications, supplements, or medical procedures. But after decades of working with older men, I've realized something very clear. The prostate responds most powerfully to daily habits, especially the habits you follow before bedtime, because nighttime is when the body goes into its deepest recovery. If you prepare your prostate with the right environment, your body will handle the rest on its own. After working with hundreds of patients, I've identified 3 core factors that every effective habit focuses on. First, reducing inflammation. Low-grade chronic inflammation is the biggest reason the prostate becomes sensitive, slightly swollen, and easily irritated at night. Avoiding spicy foods, alcohol, and salty processed foods is a simple but extremely effective way to lower that inflammation. Second, improving pelvic circulation. Poor circulation leads to congestion in the prostate tissue, causing pressure when you lie down. Gentle abdominal and groin massage, combined with slow breathing, helps restore healthy blood flow into the pelvic region. This is the first step toward calming the prostate. Third, relaxing the pelvic floor. Many men over 60 don't realize their pelvic floor muscles have been tight for decades, from years of sitting, driving, or stress. This tightness puts direct pressure on the prostate and the urethra. The 5-minute nightly relaxation technique is the best way to release this tension. If you stay consistent with the 5 habits I've shared, the warm water, pelvic floor relaxation, gentle massage, avoiding the 3 irritants, and the 4 6-minute breathing exercise, you'll start seeing meaningful changes: fewer nighttime bathroom trips, deeper sleep, less pelvic pressure, better mood in the morning, and most importantly, a prostate that finally gets to rest instead of being irritated all night. There's no miracle cure, just simple, natural habits with long-lasting power, especially for men over 60 who are ready to listen to their bodies. If what I've shared so far has helped you understand your body better, and if you find these habits useful for your sleep and prostate health, go ahead and give this video a like. It lets me know this content is truly valuable to you, and it gives me the motivation to keep creating even better videos dedicated to men over 60. Before we finish, I want to remind you of something important. Because while these 5 habits can help your prostate calm down significantly, they do not replace proper medical evaluation when your body shows warning signs. If you experience any of the following symptoms, please get checked right away: burning or painful urination, blood in the urine, even once, sharp pelvic pain or discomfort when sitting, low-grade fever, with lower abdominal pain rated, a suddenly weak urine streamer. These are signs your body needs a closer examination, as they can be related to prostatitis, a urinary tract infection, bladder stones, or other conditions. But if you're only dealing with nighttime urination, mild pelvic tension, or trouble sleeping, the habits I've shared with you today can make a meaningful difference, sometimes in just a few days. I'm sharing this not to worry you, but to help you listen to your body the right way. The prostate is small, but it is honest. It will always tell you when it needs gentle care, and when it needs a doctor's support. If you practice the 5 nighttime habits I shared, the warm cup of water, the slow breathing, the pelvic floor relaxation, the light abdominal massage, and avoiding those inflammatory triggers, I truly believe you'll feel the difference within just a few nights. Your prostate will feel calmer, less reactive, your sleep will become deeper, and you'll wake up with a lighter, more comfortable feeling in your pelvis, a feeling many men over 60 haven't experienced in years. Before you leave this video, I'd love to hear from you. What bothers you the most at night? Nighttime urination, pelvic pressure, or difficulty sleeping? Share it in the comments below. I read every comment, and your experiences help me create better and more relevant videos for this community. And if you found this content helpful, don't forget to subscribe to Senior Men Health Secrets, so you don't miss any of the upcoming videos designed specifically for men's health after 60. Thank you for spending your time with me today. I wish you a peaceful night and a healthier, calmer prostate with each passing day.